Everyone. Welcome to our May Food Security Community Call. We're just sort of letting folks in from the waiting room, so we'll get started in a few minutes. If you're just joining us, feel free to put your name and your organization in the chat box, introduce yourself to the group, and we will get started shortly. Good afternoon, everyone. If you're just being let in from the waiting room, we are just waiting for some more folks to arrive. And please introduce yourself in the chat if you haven't done so already with your name and organization. And we will get started shortly. Esther, I believe, has put the agenda in the chat. Yes. And we'll do so periodically for those who are just joining and might not have seen it. And I believe we're waiting, let's see. For our first speaker as well. So again, as you're joining us, please introduce yourself. Welcome to our May Food Security Community Call. We'll get started in just a minute or two. For those of you who don't know me, I am Elizabeth Tuin with the Food Council. I am taking over for Anne Marie today. She is at another meeting, but hopefully she will join us midway through, so you will get to see her. And all right. Again, just waiting for a few more folks to join. Bear with us for a second as we just get situated.
Hey, Elizabeth, do you mind making me a co-host? Yeah.
I just did. All right. Is Liz Leach with us yet? Does anyone see Liz? All right. Well, we will get started. Again, I'm Elizabeth. Welcome to our May Food Security Call. Stepping in for Anne Marie, who will be joining us a little later. Welcome to everyone. We have a pretty full agenda today. We might have to move things around here and there as we as our speakers join us. We're very excited for our lineup today. We were going to start with a brief update from MCPS on summer meals and an introduction to a new member of the team there. Is Liz Leach on the call? Nick, I see that you're here.
Yeah, Liz.
Hi.
Hi. I'm just texting with her. She doesn't have the link, so I'm just resending it to her. Yeah, so if you want to, I mean, I don't want to hold up the call, so just sending this to her now. But I'm happy if she's able to get into the next minute or so. My name is Nick Geer. I'm new to DFNS, Division of Food and Nutrition Services here at Montgomery County Public Schools. I am the wellness supervisor, so working on a lot of front-facing student and community and partner engagement. Anybody who has a vested interest, which should be everybody in school food in the county, and I will be, working on farm to school initiatives and menu development and menu satisfaction within our communities and especially with our students. So I'm excited to meet with all of you separately and in this call. So yeah, and I'm coming most recently from DC, from State Superintendent of Education there, and was on the DC Food Policy Council until about 2 weeks ago. So I'm looking forward to working with you all.
Thank you, Nick. Welcome to our food security family here. And I see Liz is on the call now. Did you want to give us a brief update on summer meals and introduce Nick to us?
Sure. It sounds like Nick went ahead and introduced himself, so I'm glad that he did. Hi all, happy Monday. Sorry for my technical difficulties. Happy to share a brief update on the summer meal service or summer food service program from the MCPS side of things. We are gearing up for summer meals, and so for those who may or may not be, I don't know how familiar folks are, we offer two different kind of meal service models during the summer. One is similar to what you'd see during the school year. So we're serving meals off of a serving line in a school, and students are coming through that line, very similar to what we see in the school year. Again, a little bit of differences because they're programmatically different. But those are primarily at sites that are housing summer school programs. So where you see MCPS summer school programs, we will have sites like that, feeding kids there, and any other programs that are at those sites as well. Then we also have sites that are not at MCPS schools, right? So they may be at Parks and Rec sites, they may be at apartment buildings, they may be just a variety of places. And those sites will have more of a bagged meal operation. So that even there are two sites, I believe, on our that we've served in the past that we plan to serve this summer that we serve out of our DFNS vans, and we bring coolers and we serve our bagged meals out of those. So there's just a whole variety of different kind of operational models during the summer. So our list of sites that we anticipate feeding during the summer, as well as the different time periods that those meals will be available, is still being developed. There's always a lot of moving parts during the summer of programs that are up in the air of if they're running, not running. So we are still putting that together. And once we have a finalized list, we will make it available. We also always make it publicly available on our website. So we anticipate having that within the next few short weeks. And we're gearing up, getting staff ready, getting menus ready, and almost getting ready to make that switch while we still have, I believe, about 5 weeks left of this current school year. So still doing that. Let me see. I see the chat has a couple questions. Nope. That was all that I wanted to share, unless there's anything specific that folks have questions about.
Thanks, Liz. We'll open it up to the floor for questions, keeping in mind that our next speaker is going to be able to cover the new summer SNAP program or summer EBT program. So if you have questions in that arena and want to hold off, you'll hear from the expert in a moment. Any questions about summer meals? All right. Well, thank you for the update, Nick. Welcome again. And we will turn next to our next speaker. We're very excited to have Emily Bauer with us today. She is the Senior Director in the Office of Nutrition Assistance Programs for the Maryland Department of Human Services. And she will be providing us with an overview of the programs under her purview. Emily, you should have co-hosting authority and be able to pull up slides if you'd like.
Okay, thank you. Let me see if I can share my screen. Give me just 1 second here. Bear with me for just a second.
Sure. I have the PDF too, so if you run into trouble, just let me know and I'll pull them up.
Okay. No, I think I'm good. Let me just see if it'll
Great.
let me actually share my screen. Okay, can everybody see my screen?
Yes.
Okay, great. All right, so yes, so thank you for having me. My name is Emily Bauer. I am the Acting Senior Director for the Office of Nutrition Assistance Programs with Department of Human Services. And I am here today to just give you a really quick overview of the programs that I oversee within the Office of Nutrition Assistance Programs. And then I will give a quick overview of our summer EBT program, which is what we're calling Maryland Sunbucks. And then we can answer questions at the end. So I'll be fairly quick because we have a lot to cover. And I know there'll be lots of questions, so I want to give a lot of time to that. So we'll start. So like I said, I oversee the Office of Nutrition Assistance Programs. So I have a lot under my portfolio. Number one is the Supplemental Nutrition Assistance Program, which is known as SNAP, which helps low-income households buy food they need for good health. Everyone has the right to apply for SNAP benefits. I also oversee the department, the program for Supplemental Nutrition Assistance Program Employment and Training, which we call SNAP E&T. That program connects people who receive monthly food SNAP benefits to job-driven training programs. The training programs are free of cost to SNAP participants. They run on an average of 12 to 16 weeks, train participants for employment in industries that include but are not limited to welding, construction, machine operation, manufacturing, healthcare, hospitality, computer, technology, IT. Many of our SNAP E&T programs also offer job placement, retention and support services that help program graduates find and keep employment. I also oversee the Bureau of Special Grants and Emergency Food Programs, and that's a pretty big umbrella, but we do have several different programs under that department. One of them is the Emergency Food Assistance Program, which we call TFAP. It is an assistance program that was created through the Emergency Assistance Act of 1983. It represents a partnership between the United States Department of Agriculture, farmers nationwide, and state governments across the country. This partnership provides federal funds and food commodities to each state to be distributed to eligible agencies. Every state receives an allocation of funds and commodities based on the population, poverty, and unemployment rates. DHS is the TFAP administering agency in Maryland. We do contracts with the Maryland Food Bank and Capital Area Food Bank to receive and store food available from USDA and distributes it amongst eligible soup kitchens, food pantries, and shelters within all 24 Maryland jurisdictions. We also oversee the statewide nutrition assistance equipment program, which we call SNAPE. That is a statewide nutrition assistance equipment program that provides annual grants to emergency food providers to enable them to purchase equipment such as freezers and other appliances that can increase their capacity to purchase, store, and distribute food. And funds are available for all jurisdictions, and folks are basically able to apply for that program. We also oversee the Maryland Emergency Food Program, which we call MEEP. We call it MEFAP. Sorry about that. We administer annual grants to feeding organizations so that they can purchase food and provide groceries and meals to families in need. These organizations are tax-exempt agencies that include soup kitchens, food banks, food pantries, shelters, residential treatment programs, and after-school programs. MEFAP funds are allocated to all 24 jurisdictions in Maryland based on population, poverty, and unemployment. And again, that's a program that a lot of food banks and food pantries are able to apply for. We also oversee the Restaurant Meals Program, or we call it the RMP. This is a state option program that allows certain SNAP clients who may not be able to prepare meals for themselves or who do not have permanent housing for storing and preparing food, that they're able to buy prepared meals at restaurants with their SNAP benefits. Restaurants can apply to participate in this program as well. We also oversee SNAP outreach, which is where we partner with a lot of community-based organizations, or what we call CBOs, where they then contract with us to help provide assistance to customers in completing applications, recertifications, and assisting with navigating the programs through DHS for eligibility and enrollment. We also oversee SNAP education. We currently have a local administrating agency with the University of Maryland Cooperative Extension. They oversee a lot of our SNAP Ed program. This program provides training and integration of nutrition education into family centers, elementary, middle school, and local departments of social services across the state. All right, so in a nutshell, that's kind of the umbrella of what I oversee with the Office of Nutrition Assistance Programs. I'll go ahead and kind of go through our Sunbucks program, and then at the end, I think we'll just take questions for everything. So, so just new off the press, right? So we are about to launch our new summer EBT program, which we are calling Maryland Sunbucks. As you can see there on the right-hand side, we have created our logo, which is similar to a lot of other states across the country with Maryland Sunbucks. The Sun stands for Summer Nutrition. So what is Maryland Sunbucks? It is a summer nutrition assistance program that will be provided to families through the State Department of Human Services, or DHS, in partnership with Maryland State Department of Education. And then also the USDA for the Food and Nutrition Services. So Sunbucks will provide additional SNAP benefits to children during the summer months. So what you need to know. So Maryland is estimating that about 90% of our children across the state will be automatically enrolled, or what we're calling direct certified. So most parents or guardians will not need to do anything. Their children will be direct certified. Children that will fall under that direct certification or automatic enrollment will be children that have received free or reduced price meals at school within the preceding school year. So any child that received free and reduced meals would automatically qualify for direct certification. We're also looking for any child that is school aged between the age of 5 and 18 and part of a household that receives some type of needs benefit. So whether it be SNAP, TCA, Medicaid, or if a child has been placed in foster care. Those are all categorical eligible children that will be direct certified for the Sunbucks program. So who needs to apply? Only children who are enrolled in community eligibility provision, or what we call CEP schools, who don't meet the direct certification eligibility for one of those other programs will need to apply. So we're estimating about 50,000 children that are enrolled in CEP schools could potentially need to apply for our Maryland Sunbucks program. Applications for Maryland Sunbucks will open up probably mid to late June. We're looking right now tentatively at June 17th for our online application opening up. So we'll definitely get that word out to everyone that when that does occur. And that will just be on our normal consumer portal MD Think page where folks can apply for regular benefits as well. There'll be a separate tab there where they can apply. Applications for this summer operational period, so for this upcoming summer, will need to be received by August 31st to get benefits for the summer of 2024. And again, it's just for those children that don't meet direct certification, which would be children enrolled in a CEP school. How do they apply? They can apply using a paper application, which we will be sure to disseminate to everyone. And then also through our My MD Think consumer portal, which is the normal DHS website online consumer portal. Families do not need an account in the consumer portal to apply for Sunbucks. There'll be a separate tab where they can just go in and submit their application. They also don't need to provide a social security number, proof of citizenship, or proof of income like pay stubs. Most of the Application process is attestation. So folks just need to input their information on the application. There are some eligibility requirements for those that don't meet the direct certification. To qualify, families must meet the income guidelines if they are not direct certified, receiving either free and reduced meals or some type of DHS needs-based program. There is a link here to the guidelines, and it follows the National School Lunch Program and School Breakfast Program guidelines. And additionally, a child must be enrolled at a school at any time since July of 23 that operates a national school lunch program. So only children that are enrolled in a national school lunch program or school breakfast program could qualify for the program. So most public and charter schools and some private schools operate those programs. There's also a list here that you can find out if your school operates a national school lunch program for individuals. Benefits. So eligible children will receive $40 a month starting for June, July, and August for a total of $120 in total benefits. Benefits will not be prorated. So if a child is deemed eligible at any point within the June, July, or August month, they will receive the total summer benefit. So if we received an application on August 31st and they are eligible, then they would receive the full $120. Issuance. This is an important piece. Maryland Sunbucks food benefits will be loaded onto existing SNAP EBT cards if families are receiving SNAP or if they have received in the past. So if they have been issued a SNAP benefit card, regular EBT card, then we are going to load as many of the Sunbucks benefits as we can onto that family's card. And that's from a customer service standpoint. We don't want people to have, multiple cards if it's not necessary. So they will be issued to existing SNAP benefit cards. If families or children do not currently receive SNAP benefits, then they will be issued a white Maryland Sunbucks electronic benefit card or an EBT card. And this just kind of gives you a preview of what it will look like. That is the actual template for the mock-up. We are going to, if we can, when possible, if we can group children together and link them to a head of household, then we are going to issue one white Maryland Summer EBT card to a head of household with all of their children on that one card. If we are not able to link the children to a head of household, then we will issue the card directly in the child's name. So essentially there's three ways: on an existing SNAP EBT card, or a white card listed in the head of household name, or as a last resort, directly to the child. We are looking to start mailing out those white cards beginning probably mid to end of June. And that's kind of a high level overview. So I'm going to stop here. I'll answer as many questions as I can. I'm sure there are quite a few, and that was kind of high level. So if we want to get a little deeper into the weeds, we can as much as possible. So I'll open it up. Stop sharing my screen here.
Thank you for that, Emily. And I think we all want to thank you and your staff for really ramping up, what I know has been a very sort of heavy lift given the turnaround time on what is a very significant program. So we're starting to see questions filtering in through the chat. Do folks want to come offline and ask their questions? If so, put your hand up. Otherwise, I'm happy to read those out from the chat. All right. Let's see. Well, there's one question about if the program is for the summer, why is the application period starting after school gets out, and how quickly will they get benefits if they qualify after applying? So if you have any insight on when the benefits will get loaded on those cards generally, but then also that time difference, that would be great.
Sure. So ideally, we understand it's not, we were given a very short period of time to be able to set up this program for this summer. So ideally, it's a lot shorter time period. Yes, it's not the beginning of summer. We understand that, but Maryland really wanted to ensure that we are able to implement this program for this summer. And so a although it's not ideal, we do feel like we're going to be able to, like I said, we have about 90% of our children. So we're figuring about 500,000 children across the state are going to be eligible for this program, and about 90% of those children should be direct certified. So our goal is, and we have some kind of behind the scenes technical pieces that we have to work with our EBT provider with Conduent on issuing cards and things of that nature. And there are a lot of other states across the country that are also doing the same program. And so there's kind of a competing, what can they actually produce? And so we're still kind of working out our timelines, but our hope is that we are going to be able to actually issue benefits towards the end of June and early July. And then those that are direct certified will get the benefits issued to them in $40 increments if we can do that way. If not, then they'll be issued basically similar to kind of how our SNAP program is set up currently, where when you apply, if you're due benefits at that time, you'll get that issuance, and then you'll get it on the issuance date for the next 2 months. So, and this is going to be a permanent ongoing program. So we feel pretty confident that although this year is not super, we've had to set it up really quickly. It's not ideal. But we feel like going forward, we should be able to do it where we have an application period ahead of the summer and really do it the correct way going forward. So, so I think that's a really great question. But yeah, we're looking to issue benefits probably towards the end of June, 1st of July.
Elizabeth, do you want to ask your question?
Sure. Thank you. Yes, thank you. Well, thank you to MoCo Food Council for hosting this call, and thank you, Emily, for joining and giving us your time today. I have a couple of questions. The timing one was already kind of answered, and we understand that it's been a lot of back and forth with USDA, so completely understand that the timeline is not ideal, but DHS is doing its very best. One of my questions is, well, actually, both of my questions are related to timing. My first question is, so the application is not going to go live until June 17th, but that's only impacting a small percentage of students who are going to have to apply. I'm wondering if we can expect for a web page to go live earlier than that, ideally this month, to provide information to families, but also to outreach organizations like us. It's really good for us to be able to get word out about this program, even for people who are directly going to be enrolled and getting those benefits, just so that they're not surprised when they get benefits on their cards in June, July. So that's my first question. And just quickly, my second question is, will folks who do have to apply and get their application in late June, early July, will they be getting a batch of benefits in July, like at the same time? Or what's that going to look like if people are not able to get their first round of benefits in June?
Sure. So thank you. Thank you for the question. So yes, so we are very close to being able to go live with our online website. So we will direct, and we have a lot of information. We have FAQs, we have the income guidelines, we will eventually have the online application where they can go, the link so they can apply online. We'll have our PDF application. So if people need to print it out, they can do that as well. So, and we'll definitely share that out. As soon as we have that. I think we're in the final stages of getting approval. And so hopefully, yes, we want to get that out as soon as possible. We're also working really closely with MSDE. We're hoping to maybe do some letters that can be sent home or some robocalling. We're looking at a couple different scenarios to be able to get information out to households. So we are working very closely with MSDE on our communications strategy. And we're also, like I said, we'll be able to provide some additional information with our FAQs. And then I think your second part of your question was around issuance. So ideally, we had kind of set dates for June, July, and August that we were going to issue benefits. But because of some of the processing constraints of per Conduent, we may have to adjust that just a little bit. And that's kind of really out of our control at this point in time. So we are working with them really closely. But essentially what will happen, yes. So if someone is deemed eligible, let's say that they put their application in July 1st, okay, and we've already, benefits have already been issued for the June allotment. Let's just say I don't have that specific date. But what will happen then on July 1st is if they're due for June benefits, they'll get their $40 upfront. If we have a July issuance date that's pushed later at the end of July, then they won't get that July benefit until that issuance date on July. If for some reason we don't get an application till like August 20th, then essentially what will happen is they could potentially get $80 for June and July. And then if our issuance in August is not till the last day of August, then they would then get, so they could get $80 and then an additional 40. If it doesn't come until the clear at the end of August, then we would just do that lump sum of 120. So hopefully that answers your question. But we want to get benefits out as quickly as we possibly can to those folks that are eligible.
Thank you so much. It does. And is there, I know you said ASAP on the webpage. Do you think it's going to happen like this week or next week? Is there any like time frame of when that web page is going to be live?
So I actually was hoping that it was going to be live last week. So I'm anticipating at any moment. So I can't give you a definite, but we are very, very close.
Okay, great. Thank you.
Sure. You're welcome. Thank you for the questions.
Allison?
Yeah, thank you. Thank you, Emily. Just want to echo everyone's appreciation for your presentation and for all the work that DHS has done to get this exciting program off the ground. So, knowing that this is sort of very similar to PEBT and that, we're a community-based organization, helps people with SNAP, we anticipate that we're going to get a lot of questions, right, about this. And then most of the questions will revolve around, I lost my card, or I don't have my card, or I don't, they didn't get on my card. And we've always had to kind of funnel people to the card customer service number, which in the past has not been, the best resource for them. So I just wondered if there was any sort of like fortification of that resource that's going to be done, just knowing that there, July and August are going to be, hot months for that, customer service that people are going to need.
Yeah, so great. Thank you. Thank you for that question. So so we learned a lot from PEBT. Ideally, we wish we would have had a little more time to set this up from the beginning, but we do feel like we are in a good place. There's been a lot of thought that's gone into this implementation of this program. So we do have some staffing structure. So we are able to hire staff specifically for this program. And so we are going to have dedicated staff across our state in each local jurisdiction. And then also we're going to have a few counties that are going to be what we're calling processing jurisdictions. And they're going to man the hotline. So we are still going to have people calling our 800 number, but then they'll have an option where they can call and specifically for our Sunbucks program. And then those calls will be directed directly to those dedicated Sunbucks staff. And so our hope is that most of those calls are going to go directly to a case manager that's going to be able to basically handle whatever the situation is in real time, so that we're not having to put in work orders and having to pass the customer around. They should have the ability to be able to request a new card on behalf of the customer as well, because we do know that, and update addresses, because we know that that's been an issue in the past as well. So we're hopeful that I think a lot of that will be very clear on our FAQ. We'll be able to share some flyers. It'll be on our website, but we're really trying to streamline a lot of that. Now with our white cards, this is just a kind of a side note. So that with the White Summer Maryland EBT cards that are being issued for this program specifically, they will not be available over the counter. So they will have to be requested by phone, either by a case manager within DHHS or the customer themselves. So existing SNAP cards, a lot of our locals can provide like what we call a vault card, but because of the production issues with these white cards, there's not going to be an excess supply in the locals. So that may be beneficial for everybody to know up front that they'll have to request it from the EBT replacement. Hopefully did I answer all your questions? I think I did. Okay.
Yeah, thank you.
Sure.
And just, to add on to some of the communication piece, we get so many questions from people who are asking about SNAP when what they're really asking for is about this program. And we thank you for giving it a name other than something SNAP related. So the Sunbucks is really a great branding. We appreciate that. But to the extent any and all communications could sort of clarify that this is not SNAP, that would, I think, help go a long way towards maybe.
Yeah, and Maryland has
Handling some
had,
of the
in the
confusion.
past, we've had summer SNAP, which we still potentially, and then we have PEBT. So there has been a lot of confusion around those programs. And so specifically that, I think that's why we took on this, the FNS branding, is because then if you also have folks that are coming from state to state, that they understand that it's the same program, that if you already receive Sunbucks in another state, you cannot receive duplicate benefits. And that's another good piece for a lot of the LEAs and community-based organizations, is that we will want to encourage families to apply if they need to apply in the school where they basically ended their last school year. So if you have someone that's moving from state to state, let's say they lived in West Virginia, but they're moving to Maryland, we're encouraging them to apply in West Virginia because that's where they were last enrolled in school. And there's a good chance that they may be direct certified through that state. And we want to ensure that we're not giving them duplicate benefits.
Liz, did you have a question?
Hi, yeah. More of a comment, Emily. Thank you. We've been hearing a lot about this, and so it's wonderful also from our end to get some of the insider insight. MCPS is happy to help communicate. So anything we can do to share out, please let us know. We have really robust communication, and I know we're a trusted partner for that information. So we're happy to push that out from our lens as well. I know the eligibility regarding CEP is going to be confusing for folks. And so anything we can do to support that, I'm just putting that out there. There was one part of the slide, the slides aren't up right now, but there was one part that said who's eligible, and it said anyone receiving free or reduced price meals. I could see that confusing our folks. And so we may just want to think through how we talk about that. Because students at CEP schools do receive free or reduced price meals. And so they might then have questions on, well, they said anyone who receives free or reduced price meals is eligible, but I'm not. And so happy to work through that together.
Sure. Yeah. And technically they are eligible, but they've not had to apply. And that's the determining factor. So yeah, I definitely take that feedback with a grain of salt, because I do think that it's going to be a little bit confusing. But we also may have CEP children, which I'm hoping. So we have a $50,000 or $50,000 estimate of who we think may have to apply. That's the enrollment from CEP schools. But we're hoping that a lot of those folks may already be receiving SNAP, TCA, and so they still may already meet that direct certification piece.
Yeah, and I can give you a piece of good news now. We have about 35,000 students enrolled in CEP schools, and so and definitely there are direct cert kids in there, so that should lower that number for you.
Yeah. So, and I think the other thing which may be beneficial for you all to know, as just folks that want to be educated on how it works. So the way that we've developed our system is when we have someone that comes in and starts to apply for the Sunbucks program, initially they'll input their children's information in there. And then when it gets to a certain point in the application, we're actually going to scrub that data to our backside data of our direct certification list. So if those children are showing that they're direct certified on our list, then we're going to have a pop-up that says, you do not need to complete this application because your children are determined direct certified. You'll get an eligibility letter or, a determination letter in the mail. And then only those children that don't meet that 100% are the applications that are going to be pushed through the system to be basically, and then we're going to have another piece where if we're going to have our eligibility rules in our system. So those applications that don't meet the direct cert, if they meet our regular eligibility rules, the system is going to auto determine eligibility on those. So there should only be a fraction of applications, hopefully, that we will actually have to touch and be able to process. And that would be anything that comes back with conflicting information. You may have households where you have a child that's enrolled in a national school lunch program meal where they got free and reduced, but then you might have an older child or someone that is enrolled in a CEP school. And so those applications may come through that we would then have to look at that, because some may already be direct cert and some may not. Yeah. So, but that's important, I think, for you all to know that when we start processing those applications and people go, and we did that purposely to try to help alleviate, thousands and thousands of applications that we don't need to process.
It sounds like you have a really robust system. That's wonderful. Similar to Allison's kind of thoughts, like I'm trying to think of all the questions we are gonna get, and then
Yeah.
proactively talking about like what communication we can all put out to alleviate that. Whether we're getting the questions or the food council is getting the questions, or just to reduce confusion, because I know this is new and slightly different than PEBT, and so obviously with that comes those different nuances.
Yeah. And we're actually talking about too, maybe creating some type of a town hall where we can share a link and do kind of a broad presentation for a lot of our LEAs, community-based organizations, as many people as we can, to just kind of capture and give a high-level overview so that there's a general understanding of the program too. So we're working on that in collaboration with MSDE and our comms team.
This will be a great learning experience for what can only be a smoother 2025 and beyond, I'm sure.
For sure.
I did see a note in the chat about the amount. And just so everyone is clear, this is a federal program. So these dollars and the amount that everyone is getting is dictated by Congress. And there are opportunities for states to always try to find more money for these programs. Like Emily mentioned, our summer SNAP program, but with budgets being tight, I think we all would love for these amounts to be greater, but we are all sort of bound by the programs themselves and the resources that we're able to devote to these things. Emily, we had a question sort of off the topic of Sunbucks, but you know, there were efforts in the General Assembly to raise SNAP amounts. There are many advocacy routes for people to go with the legislature. But, you know, there's also a lot that's going on the administrative side and with DHS. And we were curious how you like to hear from the community, from folks who are looking to give feedback or see change under the programs that you oversee. And what does that look like for you?
Sure. No, thank you. Yeah, so I think, I'm in an acting capacity still at this point. So I've been in this role for just a few months now. I guess it's probably closer to 8 months at this point. But yeah, as I'm, you know, starting to kind of take on more roles and start developing relationships with external partners, I'm always open for communication. I think this is a good setting too. So anytime that you have, you know, times that you want me to present or come and ask questions, I'm happy to do that. You know, you can always email me. If you want to have higher up than me, you can let me know as well. And I can try to coordinate, you know, meetings, because this administration, our DHS administration, is very open to trying to collaborate and really listen to advocates. And at least I feel that they are very strongly about that. In comparison to some of our previous administrations, maybe it's not been quite as welcomed in the past, but for this administration, I really do feel like we want to collaborate and we want to educate. So I think sometimes a lot of this past legislation, there was a lot of kind of miscommunication or misinformation that was being provided around some of our programs. And so, you know, just making sure that the air is clear and that we can have kind of a safe environment where we can talk about what's happening. And then, yeah, you know, and push the envelope a little bit, you know, it's fine too. You know, how can we collaborate with what we have, but then also how can we, you know, step outside of the realm of what we're already doing and what can we do better? And I think that that's an approach that not only me, but this administration has kind of taken.
Well, just echoing what's already been said, but we really do appreciate your presence here, the information you've shared, your openness to future attendance, which we will hold you to, no doubt.
Sure.
And just a quick plug, I saw that Elizabeth put in the chat for Maryland Hunger Solutions. What is it? On June 5th, federal legislation. Elizabeth, help me out here. I'm having trouble.
Oh, yeah, I can come off mute really quick.
Synthesizing.
So just very quickly, there's been chats about benefit adequacy. And so for, you know, these programs that are created at the federal level, you know, it's really important to speak with our Maryland legislators in Congress and the Senate. So we have a lobby day Wednesday, June 5th, that is part of the Food Research and Action Center's National Anti-Hunger Policy Conference. So that's June 3rd through the 5th, and I put a link in the chat. But yeah, if you're a Maryland advocate and you want to join us on June 5th, we're looking for more folks, including folks from Montgomery County. I think we have a few Montgomery County folks signed up already, but yeah, just let me know.
Thank you. Thanks for sharing that. And thanks again, Emily, for all of this information.
You're welcome. Thank you all. Thank you.
Any other questions for Emily? You can put them in the chat. We'll make sure to find a way to get them to her. We are running a little ahead of schedule here. I'm thinking we might have to move some things around on the agenda. Catherine Nardi, are you here? Would you mind providing us with your OFSR update for the month?
Sure. Hi, everyone. My name is Catherine Nardi. I'm a program manager in the county's Office of Food Systems Resilience. We are really excited that most of our grant programs are either out in the open and everyone knows about it and can apply to it, or they're already in process. So today is actually the deadline for our resident and community gardening grant program. Our review panel will meet over the next week or so and make decisions on funding. So for any organizations that applied for the resident community gardening grant program for FY24, or if you are interested, make sure you get your application in by today, and more information should be available by the end of the month. We just received our mid-cycle reports for our FY24 school-based food assistance grant program. And we're already seeing the impact that those programs are having in the community. Those programs are situated at 35 Montgomery County Public School sites. I see Pat Drumming is here and Marco is on, and a couple of other partners that are leading those programs. So thanks so much to the 8 organizations that are leading school-based programs. Those FY24 grants will run through June 30th. And we're anticipating, if the budget process continues as it has gone so far, that we'll be able to launch the next round of the grant program by the beginning of June for interested organizations, and hope to be at the same or more schools in the 2024-25 school year. We are just in the final stages of processing the agreements for our Food as Medicine and SNAP grantees, but our press release already went out. So if you didn't see the press release, we funded 5 organizations through the Food as Medicine grant program. It's Adventist, Holy Cross Gaithersburg, Community Farm Share, Cheer, and Casa Rubin. And we funded 5 organizations through our SNAP outreach grant program. And they are the Montgomery County Food Council, Manna Food Center, Maryland Hunger Solutions, Community Engagement and Consultation Group, and Catholic Charities. So we're really excited for those programs to all be up and running in hopefully the next couple of days. We had a little bit of a delay with the administrative process on those grants, but we are moving forward, and we are really excited to see the impact that those programs will have in the community. They'll be reaching residents through healthcare providers, through the school-based health and wellness centers, and through community engagement events and outreach. So a lot of different touch points for residents who are struggling with food insecurity. We are also anticipating the launch of our resident retail food access program in June. This will be an opportunity for select participants. So the program is by invite only currently, but we've been working with DHHS to identify and invite select participants in Montgomery County that meet specific eligibility criteria to apply to participate in this retail food access program. And approved participants will receive a monthly stipend to spend on groceries through a retailer of their choice. We are expecting that about 2,000 households will be able to participate in the program. And if all goes according to plan, like I said, that will launch in June and run for about 6 months. And there is funding in our FY25 budget to renew the program next year. I think that covers everything major on my end, but if anyone has any questions, thoughts, concerns, feel free to let me know in the chat box and I can get back to you.
Thank you, Catherine. Any questions out there? We've got time. Well, if you think of anything, yes, please put them in the chat and we'll make sure that Catherine gets them. So you all know how to reach her as well.
Thank you.
Thanks, Catherine. I was wondering if we have anyone on the call from DHHS that is slated to speak about the mobile health clinic. Is anyone? We had a little cast of characters here. I don't see anyone from that list. Anyone ready to do that? All right. Well, in that case, let's move on. We did, the Food Council had a couple updates, and I know there are some new folks joining us, so we wanted to give you all a chance to introduce yourselves as well. Just quickly, we are, the Food Council is ready to announce the update of our food assistance resource directory, the map on our website that lists all, if not all, most of the food assistance providers in the county with more robust, updated information. Big thanks goes out to all of you who participated in this project. It can be a bit of a lift. I see Jennifer Rankum on here. She is part of all of this, as was Anne-Marie made a huge effort to coordinate this process, and our intern Leah as well. So thanks to staff and friends who were part of this, this effort. And you know, the information is only as good as what we get from you. So if things change, we love to keep this as updated as possible. This is the most visited part of our website, and it does prove to be a useful resource for folks looking for food. So we do ask you to let us know if things change, if you want to add additional information to what's on there. You can reach us at any time for that. Let's see, is Ben from Cross Community on the call? We had a note from that he was in search of some information and we were going to give him a moment to speak. I don't see him either. All right. We do have a couple new folks. If you want to come offline and introduce yourself, we have John Gavin from Adventist Services. Are you here, John? Would you like to say a quick hello? Tell folks who you are, what you're about.
Hello, can you hear me?
Yes, I can.
Okay, I don't know, the video is not working, but it's not important. I'm John Gavin with Adventist Community Services of Greater Washington, located in East Silver Spring, and glad to be a member of this group. And we provide food for hundreds of families every week, and we also provide diapers and hygiene kits in the hundreds for people to support them in meeting their material needs. We're also a big participant in the holiday giving program in the Thanksgiving time and during the Christmas season. We did add a Ramadan distribution this year in March, I think it was. So that's us. Thanks for the opportunity.
Thank you, John. And then we also had Julia Kahn from Montgomery College. Is Julia on the call? Not sure if I saw her or not. Oh, there you are. Hi, welcome. Please, if you would like, take a moment to introduce yourselves.
Hi, everyone. I'm Julia. I am, as of 2 months ago, the new food security coordinator for Montgomery College. So I am charged with running food pantries and food distributions at our 3 campuses in the county, as well as our new East County Education Center, which just opened about a month ago. I am really excited to be here. I come out of food security work in DC and am really excited to get to know more folks in my home county and work with all of you. So thanks for having me.
Thank you, Julia. Welcome, and best of luck as you start this new venture. Let's see what else is going on. We had to update you with. Oh, Okay, so just quickly, I'm sure you're all aware, but a quick update on the Montgomery County budget process. Last week there was a hearing, and we will share the link to that hearing and the staff packet in our follow-up. And just to note, those of you asking in the chat, the slides from today's call, as well as all of these various resources, will be provided to you in a follow-up email shortly after the call. Give us a day or two to get that together, but it will be coming. But so the budget process, last week there was a hearing, and through a straw poll, the full budget was approved. Just some changes this year over years past. All of the food security contracts that were once housed generally in DHHS are going to be transferred to the Office of Food System Resilience, with the exception of the hubs programs and also any program directly managed by the Office of Grants Management. We anticipate that the full budget is going to be approved by County Council at the end of the month. And we always encourage you to reach out to your council members for questions, concerns of that nature. I'm trying to think if there's anything else. We are still waiting for our DHHS folks to show up. I do hear that they were in a meeting until 2 o'clock, and hopefully one of them is going to pop on. So perhaps that gives us a few minutes. Is there anyone else new to our community that's on the call for the first time that's brave enough to want to introduce themselves or say hello? We like to hear from everyone and get a sense of who's joining us. Looks like a lot of familiar faces on the call today. I'm hearing, Sean, that you have never introduced yourselves to the group. Do you want to be brave and pipe in? I see.
Did you call my name?
I did. I called you
did?
out.
Oh my goodness. All right. I was actually looking for the hand raise logo so I could raise my hand, but yes, I've joined some of the other, monthly meetings, but never this one. My name is Sean King. I'm the office manager at Community Engagement and Consultation Group. We call ourselves CECG for short. We help people out with a whole lot of things. So SNAP enrollment, Medicaid enrollment, clothes, household items so that they feel confident to go to the workplace, job training, basic computer classes, English classes, you name it besides immigration and housing, we probably do. And if not, then we can refer to a local partner. And I would say our biggest highlight that I want to highlight is we have over 8 languages on staff. So that's normally not a problem. So if anybody needs help, we act as that bridge towards resources for folks. So trying to get the information out there, and I appreciate everything the Montgomery County Food Council is doing. It's amazing work, and I'm super excited for whatever is to come. And the summer EBT I expect is going to be a lot, as you guys said, and I'm ready for these phone calls to come in. Thank you.
Thanks for that, Sean. And just if you wouldn't mind, how do you like to receive referrals? If you could put that information in the chat, so if folks do have clients they'd like to send your way, they can do that efficiently.
Sure. Thank you. I'll do that in the chat.
Anna Rose, did you have something to add?
Yes, I did. Hi, everyone. My name's Anna Rose. I work with Manna Food Center, and I just wanted to give a quick plug to some farm visits that we're having this summer. We received a grant through the Food Systems Leadership Network to have several farm visits around Montgomery County, highlighting culturally considerate crops that are being grown locally. And the goal of these visits is to connect these farms with food assistance providers, many of which I know are on this call, and trying to connect culturally considerate food to the populations that we're serving. So I will link those RSVPs into the chat so that if anyone is interested and available, you can sign up to attend, and I'll put my email as well in case anyone has any follow-up questions.
Great, thank you for that. And to beat anyone to the punch, yes, we will include all of that information in our follow-up email as well. So you'll be getting it from many sources, and we all look forward to those visits. Thank you, Anna Rose. I do see that Dr. Rogers has joined us. Dr. Rogers, are you here and ready to share some information about the mobile health clinic?
Yes, good afternoon, everyone. I'm here and ready to share information.
Do you need screen sharing powers?
Yes, please.
All right, one moment. You should have that now, and let me know if you have any issues.
Okay. Good afternoon, everyone. Bring up my presentation here. My name is Dr. Christopher Rogers. I'm the Chief Policy and Strategy Officer for Public Health Services here at County Government, DHHS. And I was asked to just do a quick presentation so everyone can see my screen on the mobile health clinic. Mobile health clinic, we stood up operations providing services in the community around about last December of 2023. We spent really a good, 8-10 months or so just on planning, of course, hiring the staff of the team, which I'll talk about in a moment. The mission of the DHHS Mobile Health Clinic is to alleviate health disparities by traveling around Montgomery County, providing integrated medical, dental, behavioral health, and human services. And so we really pride ourselves on ensuring that patients are able to receive those integrated services, medical, dental, and behavioral health. And we have an integrated team in order to deliver these services. We're staffed by a nurse practitioner, community health nurse. We have a licensed clinical social worker, 2 community health workers. One of our community health workers is a licensed medical assistant and phlebotomist. Of course, we have our driver, clerk, and we also have dentists, dental hygienists, and dental assistants. And so this is how we bring the integrated medical, dental, and behavioral health services to bear for the patients. Now, we provide a range of services. I would say currently, as we are in our kind of first year of implementation, really working out what works best for the community. And while we are still securing some additional resources, the mobile health clinic team is currently providing preventive screenings and referrals. As we transition into hopefully sometime this fall, we'll begin to pivot into more of our exams and treatments, physical exams, dental exams and cleanings, immunizations, and all that we do, we identify and address social determinants of health. Now we have 3 primary tracks that we service. We have our health fair track, pop-up clinics, and static sites. I was asked to talk more about the work that we're doing with the hubs, which is along our static site. So we're kind of, again, doing this first year implementation. It's a hybrid between health fair and static site. So all of the hubs, and I'll talk about this later, all of the hubs, except for one, which we're still working with to plan a start date and operations, but all of the county food hubs are static sites, and we're providing the health fair services. So we're providing preventive screenings, health education, and promotion across all of the Montgomery County food hubs. Again, as we transition into later on this fall, we'll pivot into the routine and diagnostic care services, which are our physical exams, our dental cleanings, dental exams, x-rays, mental health treatment, etc. And then we also have our pop-up clinics, where an organization can request our services. They have like a one-time event, maybe like a, you want to give, free physical exams to children on a local softball team right before the season is ready to start. And you may say, oh yeah, I would like the mobile health clinic to come out to do a pop-up clinic. Or you're having a back to school health fair and you want to request the mobile health clinic to come out. So those are more episodic type of services. Now here's a conceptual drawing of what the RV will look like or will be built like. We are still on track. The latest update I received about 2 weeks ago. The dates have been pushed back when the county would actually take delivery of the vehicle. I received an update 2 weeks ago. We're still on track, the county that is, to receive the RV perhaps sometime in September. And then once we receive the RV, when the county physically gets it into our possession, of course we want to make sure that there's some final items to be outfitted on the vehicle. Risk management has to get in, take pictures, insurance, and all of those good things. But as you can see in the vehicle, in the rear, towards the rear of the RV will be our medical exam room. You see a wheelchair lift there as well. All the doorways are ADA compliant. In the center of the vehicle, we'll have our behavioral health counseling room. You see a lab there as well for blood draws. And then the front of the vehicle will be our dental operatory. Now, both of the exam rooms, that is the rear exam room and the front exam room, they're interchangeable. So they could be used as a medical or dental. But the vision is, and I was saying this to the team earlier. I mean, they know, but I was making a point about something. The vision is that at 10 a.m., a patient can walk on and see the nurse practitioner for a medical exam. At 10:30 a.m., the patient can see our licensed clinical social worker for mental health. And then at 11 a.m., the patient can get their teeth cleaned by the dentist. That's the vision, and that's where we're moving towards with the mobile health clinic, as we had offered integrated services. Now, in all that we do, we provide a health equitable approach to care management. So we are integrating both social work and medical models, medical encompassing dental as well, when I use the term medical on this particular slide. One thing that we also are really being strategic and intentional about is ensuring that we conduct warm handoffs. And so the mobile health clinic team, you'll see lists of some of our community partners on the next slide. We've been meeting, for example, with county safety net medical clinics, like clinical organizations that participate in Montgomery Cares. And we have developed a streamlined approach for the mobile health clinic team to refer eligible patients to programs and services. And we engage the patient and the family in the handoff process. And we know that when we refer a patient to, for example, Montgomery Cares Clinic, that patient has been successfully scheduled for an appointment. So that's the warm handoff process. Again, as we continue to implement operations, we'll transition to a closed loop referral process. But I would say having a warm handoff process to start is a success. So we have community partners, internal county services and programs, community-based organizations, as well as safety net, medical, dental, and mental health services as well. For example, I know on Friday, myself and managers, we met with, I believe it's called Just Neighbors, which provides free legal services for individuals who are looking to establish citizenship in the United States. So that's an example of a community-based organization partner. And we want to make sure we refer individuals over to those services. And our open and planned static sites. So we are providing services in Poolsville, and then again across all of the county service consolidation hubs, except for right now, we're not providing service in the East County. We are still working out planning operations logistics with the East County hub. But you can find us across the hubs. One day a month, the same time, same day of that particular week. Each month, we're providing services across these sites. Now, we also have targeted zip codes. So these targeted zip codes really come into play when we think about when we're talking about the health fairs and the pop-up clinics. So as we receive, and I'll drop the website in the chat box, where you can request the mobile health clinic to come to an event. But as organizations request the mobile health clinic to come to an event, one is based off of resources, right? Resource capacity, availability of the staff, and then also prioritizing that event with these particular zip codes. So these zip codes were determined because they have, for example, a high disease burden of diabetes, emergency department utilization, other chronic disease such as heart disease, as well as the high proportion or so the primary care provider or dental provider ratio to citizens who live in that zip code is below the county average. Is another one of the other criteria for how we identify these zip codes utilizing epidemiological data. So then my last couple slides, just a snapshot of some of the data. So we've been providing services since December. We've engaged over 581 individuals since December across the hubs. Now, of course, we're not at each hub every day. We don't provide services every day. We have our in-office admin days, and then other days we're out in the field. So, I think 581 patients served in the past couple months is a good number as we continue to ramp up. As you can see, Hughes UMUC is one of our higher volume sites. Now, we started sites at different different times. So like, for example, Up County Hub, I think we've only gone to Up County Hub maybe about 2 times, perhaps. Just depending on when we started services, I guess it just depends on how many patients we've actually engaged. Clifton Park and Hughes, we've been there the longest. I think Clifton Park, we started in December, and Hughes, we started in January, which is probably an indication of why we've seen so many more patients. As you can see, overwhelming percentage of our patients are Hispanic or Latino that we are encountering. Now, we do have bilingual staff, and we also have translation services or interpretation services on site in multiple different languages based on what the prevalent languages spoken in that community. And then just the gender of patients served. Most patients that we serve tend to be between the ages of like 40 and probably about 60 or so is where we find most of our ages of our patients. So that's all that I have as far as a presentation. There's a couple of our staff members here. Let me see if you all have any questions in the chat box. I will put the website. If you would like to request the mobile health clinic services, you can complete the online request form.
We did see one comment in the chat, which led to a question. How were those targeted zip codes established? What criteria were you using for that? And just a note too, the presentation slides will be in the follow-up as well. So that zip code list will be in there in our follow-up. Sorry, go ahead, Dr. Rogers.
Oh, yeah. So as I shared earlier, there was some epidemiological data that we looked at.
Okay.
So we identified the top 10 zip codes with the most disease burden across healthy Montgomery indicators that include diabetes ER visits, behavioral health ER visits, heart disease, percentage of low birth weights. We also looked at health equity indicators such as primary care shortage areas and dental shortage areas. And so once our epidemiology team kind of triangulated all of that data, those are the top zip codes that we like to focus on.
Any other questions from folks? If you were a CBO that wanted to become one of those trusted warm handoff partners, how would you go about getting in touch or, becoming part of that referral network?
Yes, you can send us an email, and I am putting our website in the chat box. If you click on the website, then you can click on the left-hand side of the screen, send us an email, and you can send the Mobile Health Clinic team an email.
Fantastic, thank you. And there were questions about a link to the application for a site visit. I assume that is on the website as well.
Yes, that is also on the website. There's a smart form. You complete the smart form, it comes right over to the team. We have a process that we go through to determine if we're able to staff that particular site. Also to note about requesting, there's also some FAQs on the website as well. And so just to note, for weekend event, well, let me just read it from the website. You want to ensure that you complete and submit the mobile health clinic request form a minimum of 45 days in advance for weekday events and a minimum of 75 days in advance for weekend events. Sorry, 45 days in advance for weekday events and 75 days in advance for weekend events.
Good to know. So mark your calendars, folks. You do need a little lead time there. I'm sure you have many requests and would love to get everywhere, but we appreciate all of the work that you're doing and everything that's gone into putting these together. This looks like quite an incredible resource for the county. Brian Flores, not to put you on the spot, but we know that Harvest International was one of the hubs that received visits from the mobile health clinic. Is there anything you want to add about your experience with the clinic or the impact it's made on your clients?
Yes, good afternoon. They were actually just with us on the first Saturday of May, which was like a week ago, 2 weeks ago. Oh, already 2 weeks ago. And yeah, they've been amazing. They've come out, I believe, if I'm not mistaken, 3 times now. Is it 3 or is it 4, Dr. Rogers? I think it's 3.
3. Yep.
3, yeah, okay. They have been amazing. The resources that they give out, they're very friendly. The stuff that they offer, the checkups, everything, and if there's something that the clients need, they give referrals to those things. Very helpful, very, very friendly. And then just last time they came, they added the dental hygienist, the dental hygienist was very overwhelmed because there is a lot of people. So the community does benefit immensely from it. And even after, they show up, I guess word of mouth spreads, and then like the weeks following after, or the days and weeks, I get phone calls. Hey, when are they coming back? When are they coming back? So if your program doesn't have them coming out and you would like them to, then yes, please fill out, like Dr. Rogers said, that form, because they are very helpful to the community. There's always that I don't know if you would say disparity, but that not everybody has health insurance, right? And so this is a huge help to most of those people that can't afford it or just don't have it.
And just one last comment, because I see some of the other names of the other food hubs. Some of the hubs, as you all know, they provide services like at apartment complexes and at certain, and we're excited because we're going to be going directly to those locations. And so, like in the Up County hub, I know that they go to certain complexes as well as the East County hub. And so we're excited. We're going to be driving that RV right to those complexes. We're just not going to be sitting at the Up County Regional Service Center. I mean, for now we're there until we have the RV, but once we get the RV, wherever they send us on that day that we're with them, we will go. And so we're really excited to take those services directly to the community.
That's great to hear. Any other questions for Dr. Rogers? Well, thanks again for.
I see Katie in the chat box as well. We're looking to go to the back rows of the ag reserves. So we're excited to go to the migrant farms. So we're going to be driving that RV all around the ag reserve. So we're excited about that as well.
A great and very flexible resource. Thank you so much for your work and for being here today. Any other updates that anybody wants to give or notices or requests or questions? If you're still formulating or thinking about it, we did want to let you know that we are working on another in-person event for next month in lieu of a virtual food security community call. And that will be a hosted tour of Shepherd's Table. So we look forward to seeing all of you in person next month. More details to come. You know where to find us. I'm sure we'll be sending that information out to all of you as soon as it is solidified. So be on the lookout. Again, we will share those resources from today. I know that there was a lot of great information shared today, so be on the lookout for that email and our YouTube channel for recording of this call. If you missed any details and want to see it relived, that's available to you as well. And with that, I guess we get 8 minutes back in our day. We look forward to seeing you all next month. And thank you for all of your work that you are doing in the community. Thanks, everybody.